Hi, so I'm Tricia, obviously. This is Gavin, and I didn't get stuck in Bethnal Green because I walked. I don't see my voice without. So who are we first of all? So as Barts ECMC patient and public involvement and engagement group, that's quite a long term. So we're basically a group of patients. So that's actually a growing number as well. Patients, carers, members of the public, all affected in some way by cancer, whether themselves or a loved one. So we're from diverse backgrounds, and that's something we do, definitely aim to continue to work on. And as I've said already, directly or indirectly affected by cancer. So everybody involved is very interested in both the current and looking towards the future cancer research landscape. Most people on the group have participated or are ongoing participation in clinical trials, or a member of their family or friend is involved in clinical trials of some sort. And I'm sure that everybody is very grateful to have had that opportunities in lots of different ways, both as for themselves, for their own health and well-being, but also, caring about and thinking about the future, how are things evolve. Some work already as volunteers with other charities and other groups. So our main objectives is, again, to increase cancer research awareness amongst the general public, amongst patients and so on. So as anybody who listened to or was present at the talks yesterday had the same aim, to ensure equity, diversity and inclusion into clinical trials, regardless of, and we've listed some things there, but there will be others you will think of. So it's regardless of age, gender, ethnicity, abilities, disabilities, religion, culture, sexual orientation. And we are aware for some people there are all sorts of barriers as to why they might want to not be involved in a clinical trial. We aim to guarantee transparency from researchers to patients to the public, and to ensure patient and public representation in the research field.
Good morning. So what do? We advise, guide healthcare professionals at Barts ECMC with other researchers on their projects at different time points and levels. We review patient materials so they are designed and written in simple and clear language. We help to develop strategies to increase cancer research awareness and ensure equity, diversity and inclusion in clinical trials. Why is our work so important? Our personal experience adds valuable insights to research projects. Our involvement can also enhance the quality and applicability of research. Our diversity adds different perspectives to research projects.
So what have we done so far this year? So it's quite diverse, but you'll be aware, all of you, that there is a lot of paperwork involved both in treatment, any sort of general treatment, but also in clinical trials. There are lots of patients to read through. So that's been quite a big part of our role, if you like, reading through materials, making sure they're accessible, and so on. So we've been involved in several research projects. So we've provided feedback on both new and ongoing projects, which included clinical trials. We've supported application for grant funding. We've reviewed patient-facing information about clinical trials, including when patients will be agreeing or not to clinical trials, making sure that things are understood, things that a clinician might have written that is very clear to anybody in the clinical field, but when we look at it as patients, we think, I don't know what that means. We've helped promoting increasing research awareness, and currently, the recent thing has been collaborating with the Cambridge ECMC PPI group, that's hard to say, on sort of joint projects that we hope will benefit patients and carers affected by cancer. So then we've also, these are some things we've produced in the past. These are videos in multiple languages, which you can see on the patient website, helping always to increase those.
We've got posters in various points around the hospital. This is one of our lovely nurses, Philip and Sultana. This advertises the clinical trials and what's available just for people to try and get involved in. Andrew, who's meant to be standing here now telling you about this, has designed a new diary, which I can't really tell you a lot about other than Andrew's doing it. And it's going to help patients put their side effects down, give them information about different things that they can do to improve their life while they're on treatment.
And then, as we said, we've got, we are currently collaborating with the similar group from Cambridge. These are some photos from our day trip over to Cambridge, which was a lot of fun. Big tour of the hospital, which is vast. At the bottom, you can see us learning how to extract strawberry DNA, which is fun. And Gavin wanted me to point out that he's become an expert at using some of the machines. Neither of us could remember what they're called, and he now wants to be a surgeon without the training.
Yeah.
And there are some photos as well from previous clinical trials.